Good day, ma'am. I am Angel Joy De Leona from BSN 1, Section 3. And for today, I will be demonstrating the range of motion exercises. So, to start, I will do first the assessment. And today, I am here with Mrs. Christine. Hello, ma'am. I am Nurse Leona. How are you?
I'm fine. I'm okay.
Okay, so for today, ma'am, we will be conducting the range of motion. It is still part of the physical assessment in which I'm going to observe the range of motion of your joints. And of course, inspect the muscle extremities for size and symmetry. And of course, to assess also your muscle strength. Are you ready?
Yes.
Okay, so how about your feeling? Are you okay right now? Are you comfortable?
Yes.
Okay, so I will be needing your cooperation. Is that okay with you?
Yes.
Okay, so after the assessment, critically think through your data, carefully evaluating each aspect and its relation to other data. And then last, for the analysis part, identify specific problems or modifications of the range of motion procedure needed for this individual. After all of that, you have to create a plan. Identify appropriate individualized patient outcomes of the range of motion exercise, including joint have flexibility to move through full range of motion, and patient must be willing and able to complete range of motion exercise independently. Lastly, patient is comfortable throughout the range of motion exercise. Next, plan when the assessment should be done and plan whether the exercise will be active, actively assistive, or passive, and which joint will be included. So when we say active, exercises are highly independent, performed solely by the client. Nurses and therapist role may be simply to provide verbal cues. While on the actively assistive, from the word itself, there are assistive devices needed such as walking belt, crutches, strap, and etc. And then the last one is the passive range of motion. The help of the nurse and therapist here is highly needed. So in this situation, we will apply the passive range of motion since the patient cannot do the procedure alone. So to start, we will proceed to the implementation. But always remember to wash or disinfect your hands first before touching the patient. Next is obtain any supportive devices or assistance. And then identify the patient using two identifiers. So if the patient is conscious like this, you can ask her full name and date of birth. So ma'am, may I know your full name?
Christine Abendaño.
How about your birth date, ma'am?
June 26, 1969.
Okay, something like that. So if the patient is unconscious, you can check her wrist and you can see the medical ID number. So next is, if the patient is also conscious, you have to explain the procedure you are about to perform. But if it is unconscious, you can ask her guardian if you could perform the range of motion exercises. So in performing an activity like this, you have to always remember the body mechanics. So to prevent back pain, you have to raise the bed to an appropriate position based on your working height. So like this. Okay, so in performing the range of motions, there are procedures that we must follow. Remember that it is possible to move two joints such as shoulder and elbow at the same time. So let's start. First, we will be having the range of motion of the neck. First is the hyperextension. Position the head as if looking at the ceiling. The elderly person should not perform this movement because it can lead to pain or cervical fractures. Next is extension. Position the head as if looking straight ahead. And the next is flexion. Position the head as if looking at the toes. Next is the lateral flexion. Position the head and tilt the head toward the shoulder and start to the left like this and to the right. Okay, next is the lateral rotation. Face the right side and then the left side. Again, hyperextension, extension, flexion, lateral flexion, lateral rotation. Next is range of motion of the patient's shoulder. Flexion. So, raise the arm forward and overhead. The elbow may be bent to avoid the head off the bed. Next is extension. Return the arm to the side of the body. Next, vertical abduction. Swing the arm out of the side of the body and up. Next is the vertical adduction. Return the arm to the side of the body. Next is internal rotation. Swing the arm up and across the body. Next is external rotation. Rotate the arm out and back, keeping the elbow at the right angle. So again, flexion, extension, vertical abduction, vertical adduction, internal rotation, and external rotation. After that, move to the other side. So, flexion, extension, vertical abduction, vertical adduction, internal rotation, and external rotation. Next is the range of motion of the elbow. So, the first one is flexion. First, bend the elbow. And then extension, straighten the elbow. Again, flexion, extension. And then move to the other side. So, flexion and extension. Next is the range of motion of the wrist. So, we will start on the flexion. First is grasp the palm with the hand and supporting the elbow with the other hand. Bend the wrist forward, like this. And then next is extension. Straighten the wrist joint and move dorsally. Next is radial deviation. Bend the wrist toward the thumb. Next is ulnar deviation. Bend the wrist toward the little finger. Next is the circumduction. Move the wrist in a circular motion. Okay, so next is pronation. Turn the hand so that the palm is downward. And then supination. Turn the hand so that the palm is upward. Okay, so again, flexion, extension, radial deviation, ulnar deviation, circumduction, and pronation, and then the last one is supination. And then next is do it again in the other side. So again, flexion, extension, radial deviation, ulnar deviation, circumduction, pronation, and supination. So next is the range of motion of the fingers and thumb. Take special care to the exercise these joints as thoroughly as possible. You can move all three joints of each finger and the fingers and thumb through flexion and extension together. So the first one is extension. Bend the fingers and thumb onto the palm. And the next is extension. Return them to the original position. Next is abduction. Spread the fingers like this. And then next is adduction. Return the fingers in a closed position. And then next is circumduction. Move the thumb in a circular motion. Next is opposition. Touch the end of the thumb of each fingers in turn. So again, flexion, extension, abduction, adduction, circumduction, and opposition. And then move to the other side. So again, flexion, extension, abduction, adduction, circumduction, and opposition. Next is the range of motion of the hip and knee. So we will be needing to remove the blanket. So excuse me, ma'am. Okay, so the knee can be exercised together. Place one hand under the patient's knee and with the other hand support the heel. So the first one is flexion. Lift the leg, bending the knee as far as possible towards the patient's head. And then extension, return the leg to the surface of the bed and straighten. And the next is abduction. With the leg flat on the bed, move the entire leg out toward the edge of the bed. And the next is adduction. Bring the leg back toward the midline of the center of the bed. Take note, step 3 and 4 can be performed with knee bent. This allows you to give better support to some patient and affords a greater range of movement. So, now we will proceed to the internal rotation. With the leg flat on the bed, roll the entire leg inward so that the toes point in. This will rotate the hip joint internally. Next is external rotation. With the leg flat on the bed, roll the entire leg outward so that the toes point out. This will rotate the hip externally. Okay, so again, flexion, extension, abduction, adduction, internal rotation, and external rotation. And the next is move to the other side. Okay, so flexion, extension, abduction, adduction, internal rotation, and external rotation. Next is the range of motion of the ankle. Okay, so the first one is dorsiflexion. Cup the patient's heel with your hand and rest of the sole of the feet against your forearm. Steady the leg just above the ankle with your other hand and put pressure against the patient's sole of the foot with your arm to flex the ankle. Next is the plantar flexion. Change your hand above the ankle to the ball of the foot. Move the other arm from the toes, keeping the other cup around the heel, and push the foot downward to point the toes. And then next is circumduction. Rotate the foot of the ankle, moving it first on one direction and in the other. Again, dorsiflexion, plantar flexion, and circumduction. And then move to the other side. Dorsiflexion, plantar flexion, and circumduction. Next is the range of motion of the toes. So the first one is the flexion. Bend the toes down like this and avoid grasping the nails because this can be uncomfortable to the patient. Next is extension. Bend the toes up like this. Okay, so again, flexion, extension, and then to the other side, flexion, extension. And then cover the patient with a blanket. Okay, so since the patient cannot do the range of motion of the spine, I will be the one to demonstrate it. Okay, so first is the extension. For the extension, just stand straight. And then for the flexion, bend forward from the waist. And then for the hyperextension, bend backward from the waist. And then next is the lateral flexion. Bend toward the side from start on the left and to the right. And then the last one is the rotation. Twist from the waist to the side and start on the left to the right. Okay, so again, extension, flexion, hyperextension, lateral flexion, and rotation. And that's the end process for the range of motion. After all of this, assist the patient in a comfortable position. And then, wash your hands properly and do documentation. That's all. Thank you.